I'm Dr. Christina Kabash, and I'm here to talk to you today about hammertoes and bunions. What exactly is a bunion? A bunion is an angular joint deformity of the foot. What causes a bunion, and why does it hurt? Pain from bunions can come from the bunion itself, it can come from the spreading between the bones, and it may come from the hammertoe that usually results from a bunion. Bunions may be hereditary, post-traumatic, and are related to our feet getting longer and wider as we age, which may be a result of pregnancy, weight, increases in activity, and just natural aging. Bunions are also called hallux valgus. So what is it about shoe wear that causes bunions? Molding. Wide foot, pointy shoe. So a pronation deformity occurs during push-off during gait. So here's a person walking on a treadmill, and as you can see, for this person, pronation means your arches roll in when you're walking, and when your arches roll in, what happens is you start to push off with the inside of your big toe. If you have this callus on your big toe, you are a pronator. Other possible etiologies of bunions can be trauma or inflammatory arthritis. But whatever the cause of your bunion, whether it's genetic, usually from the mother, the arch falling due to pronation, poor shoe wear or molding, or trauma, or inflammatory arthritis, there is a bunion. In order to correctly treat a bunion, we need to know which joint is the problem. This is an x-ray of a hallux valgus deformity, and what you can see is this angle. This angle causes the bump that we see as a bunion. However, that angle can also come from here, or even from the toe itself. We also need x-rays to see if you have arthritis in the joint, because if you have an arthritic bunion, it is treated very differently than a bunion when there is no arthritis. An arthritic bunion is typically treated with a fusion. So back to typical bunions. Non-operative treatment, spacers, rocker bottom shoes, and orthotics that support the arch and take the pressure off the spreading of the forefoot. The most important thing, if it doesn't hurt, don't fix it. Emphasized. Goals of bunion surgery. 1, reduce pain. 2, align the bones and joints. 3, restore function and stability. 4, prevent hammertoe development and progression. So for bunion surgery, there are well over 130 procedures and modifications described. There is the simple bumpectomy, where you remove the bump. There is the Aiken, where you take a wedge out of the big toe joint and straighten the toe. There is a distal osteotomy, meaning we cut this part of the bone and shift it over. There's the scarf osteotomy, which is a bigger cut, and it's not only a shift, but an angulation, where you can take larger bunions and make them straight. And how do we assess if we've made them straight? We like to see these two little bones centered over the head of the first metatarsal. The other final way to treat a bunion is by fusing it, and these are saved for the largest deformities. So this is an example of a very large bunion that I did. Before, after, x-rays, before and after. So what can go wrong with bunion surgery? An overcorrection can result in something called hallux varus, where the big toe goes the opposite direction. If you don't correct the bunion enough or undercorrect it, then you can have recurrence of the bunion. If you don't position that first metatarsal properly with either the bone cut or the fusion, you can shift the weight from the big toe to the lesser toes, causing metatarsalgia or pain under the balls of the forefoot. People describe it as a feeling of walking on marbles or a bunched up sock, and untreated, it can go on to cause hammertoes. So what causes a hammertoe? The joint on the bottom, the capsule, gets broken down from too much pressure on it. The toe pops up. It can be partially torn on one side as opposed to the other side and then deviate off to the side. And Typically, when the big toe comes over with the bunion, it tends to push that second toe up, causing a hammer toe. Alternatively, if a hammer toe occurs first, then the big toe can come under it, filling a vacuum. Nature hates a vacuum. Hammer toes can hurt where they hit the bottom of the shoe, where they hit the top of the shoe, or where that painful joint in the ball of the forefoot hits the shoe or the floor as well. How do we treat hammer toes? If the toes are flexible, we can use splints. We can tape them, or we can do a flexible hammer toe surgery where we realign the tendons that attach to the toe. A rigid hammer toe is typically treated with a protector on the surface so the skin doesn't rub on a shoe. There can be a nice splint that goes underneath that keeps the tip of the toe from digging into the shoe. And surgically, you have the choice of the toe being stuck bent or stuck straight. Most people prefer stuck straight. So what we do is we take out the knuckle of the hammer toe and we can use an implant, or we can use a temporary K-wire that typically gets pulled in 6 weeks. Post-op treatment of bunions, typically weight bearing is tolerated for 6 to 10 weeks in a heel wedge post-op shoe. If you have a bunion that requires non-weight bearing because it was fused, you'll typically be in a cam boot for 6 weeks following surgery. So if your foot breaks down and needs to be fixed, call the tow truck. Thank you.